receiving chemotherapy for mesothelioma, your oncology team will be checking your blood counts before every treatment cycle, and sometimes between cycles as well. There's good reason for this. You may have heard terms including neutropenia, anemia, and thrombocytopenia in relation to your chemotherapy, and you may have wondered what they actually mean for your health and your daily life. Today, I want to explain what happens to your blood counts during mesothelioma chemotherapy, what warning signs you should never ignore, and most critical of all, when a low blood count crosses from something your team is managing carefully into something that requires you to act immediately. Because one of those situations is a genuine emergency, and I want to make sure you know exactly what it looks like. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a doctor, and this is not medical advice. But today I want to give you information that could genuinely protect your safety over the course of your chemotherapy treatment. So let's start with a basic understanding of what chemotherapy is and does. Chemotherapy drugs attack rapidly dividing cells throughout the body. That mechanism is what makes them effective against cancer cells, but the downside is that it also means they affect other rapidly dividing healthy cells. Most people associate that effect with the hair loss that's so associated with chemotherapy. But few realize that those rapidly dividing cells also include the stem cells in the bone marrow that produce your blood cells. The result is a predictable drop in one or more types of blood cells: white blood cells, red blood cells, and platelets. Each type plays a different and essential role in your body, and when your counts of those blood cells fall, the consequences are different for each. White blood cells are your immune system's primary defense against disease. The specific type of white cell that's most affected by chemotherapy is called neutrophils. These are the cells responsible for fighting bacterial infections. When neutrophil counts fall below a critical threshold, the condition is called neutropenia. Medical guidelines define neutropenia as an absolute neutrophil count, or ANC, of less than 500 cells per microliter, or an ANC that's expected to reach that level within 42 hours. It typically develops 7 to 12 days after a chemotherapy infusion. This period is called the nadir, or low point. Counts generally recover over the following week or so as the bone marrow catches up, and that's exactly why chemotherapy cycles are typically spaced 3 weeks apart. It allows time for the body to recover between treatments. Now, I want to tell you something, and I want you to hear it clearly, because it may be the most important piece of health safety information in this entire video. If you're currently receiving chemotherapy for mesothelioma and you develop a fever of 100.4 degrees Fahrenheit or 38 degrees Celsius or higher, you absolutely should not ignore it. Don't take Tylenol and see whether it comes down. Don't wait until morning, and don't wait until your next scheduled appointment. You need to call your oncology team immediately or go directly to the emergency room. Febrile neutropenia, which is a fever occurring when your white blood cell count is critically low, is classified as an oncologic emergency by every major cancer institution, the American Society of Clinical Oncology, and the National Comprehensive Cancer Network. The reason for this is straightforward and serious. When your neutrophil count is extremely low, your body can't mount its normal immune response to infection. A bacterial infection that a healthy immune system would handle easily can progress to a life-threatening whole-body response called sepsis within hours. As a result, mesothelioma patients on chemotherapy who spike even a low-grade fever need to be started on intravenous antibiotics as quickly as possible, ideally within an hour of the increase in temperature having been identified. Your oncology team will give you a specific temperature threshold to watch for and a 24-hour phone number to call. Please write that number down and keep it somewhere you can find it immediately at any hour. This is not a minor precaution. It's one of the most important things you can do for your own safety during the time you're on chemotherapy. Now, with that warning having been fully registered, I'm going to take a break here to ask you a quick favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. Also, if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comments section. And make sure you watch until the end because I'm going to give you valuable information on where to find resources that will make a real difference for you. The second blood cell type commonly affected by chemotherapy is red blood cells. When red cell counts fall, the resulting condition is called anemia. The platinum-based drugs used for mesothelioma, which are cisplatin and carboplatin, can suppress red blood cell production in the bone marrow. The most common symptoms of anemia are fatigue and weakness, but I want to be very specific about this because the fatigue of anemia is often much more profound and all-consuming than patients expect. It's not ordinary tiredness. It's an exhaustion that can feel completely out of proportion, doesn't improve with rest, and can make even basic daily activities feel genuinely difficult. Beyond extraordinary exhaustion, other symptoms include shortness of breath, dizziness, and feeling unusually cold. For mild to moderate anemia, your team may recommend dietary strategies to support red blood cell production, along with specific supplements that they'll advise. It's important to discuss any supplements with your oncologist first, since some can interact badly with chemotherapy. For more significant anemia, red blood cell transfusions may be recommended, or in some cases, medications that stimulate the bone marrow to produce more red blood cells. If you experience significant shortness of breath, chest discomfort, or lightheadedness, don't attribute it to general treatment fatigue without mentioning it to your team. It may signify that you have anemia, and that warrants intervention. The third type of blood cell to understand is platelets. Platelets are tiny cells whose job is blood clotting. They're what stop you from bleeding when you cut yourself or sustain an injury. When chemotherapy reduces platelet counts, the condition is called thrombocytopenia. It increases the risk of abnormal bleeding and bruising, and it's a known side effect of chemotherapy for mesothelioma. Warning signs that platelet counts may be dangerously low include unusual bruising appearing without an obvious cause, bleeding gums, nosebleeds that are difficult or impossible to stop, blood in the urine or stool, or any unusual bleeding from any site. Any of these symptoms should prompt a call to your oncology team right away. Don't wait for your next appointment. It's these risks that lead your care team to review your blood counts before every cycle of chemotherapy. They'll make adjustments to your treatment plan if your counts are too low to proceed safely. If your neutrophil counts are very low between cycles, they may prescribe growth factor medications. They can be the ones sold under the brand name Neupogen, which signals the bone marrow to produce neutrophils more quickly, which reduces the depth and duration of the neutropenic window between treatments. Managing blood counts is a standard and well-established part of chemotherapy care, and your team should be watching carefully. Your part in this is to know your warning signs, to know who to call, and to never hesitate to make a call when there's something that concerns you. To review, mesothelioma chemotherapy predictably affects white blood cells, red blood cells, and platelets in different ways. It affects them. Neutropenic fever, which is a fever during low white blood cell counts, is a medical emergency that requires immediate action, while anemia causes profound fatigue and needs to be reported and assessed. There's also a risk of thrombocytopenia, which can cause abnormal bleeding that warrants prompt medical evaluation. If you experience any of the symptoms described in this video, don't hesitate or delay in contacting your care team immediately. You can visit mesothelioma.net for more resources on managing chemotherapy side effects and staying safe throughout your treatment, or call us at 1-800-692-8608 or use the live chat feature to contact one of our patient advocates right away. As for me, remember to post your questions below, and I'll see you next time.